John, how are you?
I'm well, thank you, Kosh. What I did.
When was your knee done, John?
Well, it was about 5 weeks ago now, I think.
Yep. So, John, how many days after your surgery did you actually go home?
I think it was 2 days, wasn't it?
So, John, tell us about our new patient partner program and how beneficial or non-beneficial you found it. Basically, the concept of having a physio take you through your recovery phase at home and not having to go to a physiotherapy outpatient clinic or to a physiotherapist's rooms.
I think it's brilliant. I think that it has saved me so much time and energy and pain. It's just unbelievable. I wouldn't have, to me it's one of the best things about the whole recuperation. Instead of having to leave, go downstairs, get into a vehicle, drive to an office, wait in an office, wait for an appointment, do some activities, etc., and then reverse that. That's an enormous amount of time and energy and an imposition, whereas I can reach over, pick up the iPad, turn it on, look at the exercises and do whatever exercises I want at my own time, in my own pace, in my own situation.
So, John, tell us about your interaction with Caitlin. How often were your interactions and how happy or unhappy you were?
We make appointments according to what I think and she thinks we need, and we agree on this, and that's important because if I think I can continue with this for a number of days, then that's what we do. The iPad is brilliant because what Caitlin can do is she can look at what I'm doing. My partner picks up the iPad, shows her what I'm doing. I can walk and she can video it. She can send that straight through to Caitlin, who's watching immediately on the iPad. I can walk up and down stairs. I can do exercises. She can do close-ups of my leg to check how it's looking, etc. She can do as much as she could in an office situation without having to go there. So to me, it's remote, but it works, and it's the best way of doing it by far.
So you are given an iPad and a Garmin patient activity tracker. So tell us about the use of this equipment and the use of technology. Is it intrusive? Is it user friendly, or is it really a piece of cake?
It's so easy to use. It's just not funny. You've got an iPad. You turn it on. The exercises come up. You look at the exercise, and you do it. Okay. And when you've finished it, you press the button, say completed, and it asks also for what level of discomfort you might have felt, and you put that in as well. So the therapist is getting feedback immediately, and better feedback, because it can be recorded. And she can spend time to look at it over a bit of time, rather than having to listen to it, and then listen to it again, and listen to it again. The Garmin on my wrist here is fabulous because I know how much activity I've done during the day, and it acts like a conscience, so that if I've done plenty of activity, I look at it and say, yep, my numbers are up today, or otherwise. And it unloads onto the iPad so that the therapist can also know exactly what I'm doing. So it's a hard system to cheat, and you've got to, one of the things you have to do here is self-discipline, and it keeps you honest because you have to do these things and almost report yourself. So it makes it harder to kind of say, oh, I won't bother today, or it's too hard, or I'm not feeling well, etc., etc. It forces you to be honest, and it keeps you on track. I'm a real fan. I think that it's the way to go, and obviously it's the way it's going to go. Just a couple of things for people who are looking for the operation. I think it's important for people to appreciate that their body will feel different after the operation for quite a long period of time. My leg still feels very different, and that's something that takes a while of getting used to, and it's something you may not expect. It was a bit of a surprise to me, so I just mentioned that. The relief from my pain of walking and so on previously was almost immediate. So that's important, because if I felt the immediate loss of that pain, it made sense then of the other pain I was going through, because this was going to be an improvement long term. And I think that helps to motivate you, because you think, okay, when this leg gets fixed up and gets itself working right again, I'm going to be much better in what I can do and feel better, have less pain, be able to do more things, etc., and have a better life.
So this is John walking at 5 weeks. Okay, after his knee replacement. Turn around, John, and go back. That's because he's followed all his rehabilitation that he had to do with the patient partner program. Thank you, John.